All right, we've all been there, right? A stomach bug that just completely knocks you out. But what happens when it gets serious? What's the right medical call? Well, today we're going to break down a really cool case study to figure that out. So picture this. You've got what feels like the worst stomach flu of your life. You're dizzy when you stand up, your heart is just pounding. You know you need help. But what's the correct treatment? That's the exact puzzle we're going to solve together. Okay, let's dive right in. It all starts with the patient's urgent call. This is our first set of clues in this little medical mystery. Now, this is where the story really starts to take shape. The complaints? Yeah, that's classic stomach flu stuff. But look at that pulse. 120 beats a minute. Whoa, that is fast. That's a huge red flag, especially when you pair it with that feeling of lightheadedness. But notice a couple of other things. The temperature is normal, and so is the oxygen level. Those aren't just random numbers. They are critical clues. So we have all our clues laid out on the table. Now it's time to put on our detective hats and figure out what the patient's body is actually trying to tell us. It's all about connecting the dots. The prime suspect here is pretty obvious. Gastroenteritis. You know, it's just a fancy term for when your gut is inflamed or infected, and it's what's causing all that misery. The cramping, the vomiting, the whole deal. And here is exactly how we piece it all together. Step 1. The symptoms are just screaming gastroenteritis. No brainer. Step 2. That lightheaded feeling and that racing heart. Those are classic textbook signs of dehydration. The body is just losing fluids way too fast. And then, step 3, what's the cause? Well, remember that normal temperature? That is a massive clue that we're dealing with a virus, not a bacterial infection. So there we have it, a clear diagnosis, viral gastroenteritis, with some pretty significant dehydration. Now comes the moment of truth. You're the one making the call. You've got 4 treatment options in front of you, but only one is the right move. All right, take a look at these 4 choices. Option A is a bag of fluids and an anti-nausea drug. B is oxygen and morphine. C is cold fluids and fentanyl. And D is Benadryl and ketamine. So, based on everything we figured out, which one of these directly attacks the 2 main problems, the dehydration and the nausea? Ding, ding! If you picked option A, the fluids and anti-nausea meds, you absolutely nailed it. Now, let's break down exactly why that simple 2-part treatment is the perfect solution here. You know, it's really kind of beautiful in its simplicity. Problem number 1 is dehydration, right? So the solution is a 500 milliliter fluid bolus to get those fluid levels back up. Problem number 2 is the nausea and vomiting that's causing the dehydration in the first place. So the solution is 4 milligrams of ondansetron, which you might know as Zofran, to stop it. We're fixing the current problem while also stopping it from getting any worse. It's a perfect 1-2 punch. Look, knowing the right answer is one thing. But to really get sharp, you've got to understand why the other answers are wrong. And not just wrong, but in some cases, even dangerous. So let's take a look at our first bad choice. Option B, oxygen and morphine. I mean, it sounds like a serious medical treatment. But is it right for this patient? Not even close. First off, her oxygen level was 95%. She's breathing just fine, so giving her oxygen is completely pointless. But the real mistake here, the big one, is the morphine. Sure, it's a painkiller, but one of its most common side effects is, you guessed it, nausea and vomiting. You'd be giving her a medicine that could make the main problem so much worse. A truly terrible choice. Okay, what about option C? This one's got saline, which is a fluid, but it's paired with the painkiller fentanyl. So, is this any better? Nope, this one's also way off base. First, there's no medical reason to use cold fluids here. Regular room temp saline works perfectly fine, and more importantly, using a super powerful opioid like fentanyl for stomach cramps, that's like using a sledgehammer to crack a nut. It's just complete overkill and totally unnecessary. And that brings us to our last option. And, well, this one's a bit of a head-scratcher. Diphenhydramine, that's Benadryl, and ketamine. Yeah, this combo just doesn't make any sense for this patient. While Benadryl can sometimes help with nausea, it's definitely not the go-to drug. Ondansetron is much better. And ketamine? It's a powerful anesthetic. It has absolutely zero, and I mean zero, role in treating the stomach flu. This option is just plain wrong. So after we've looked at all the evidence, picked the right treatment, and debunked the wrong ones, what's the one big idea? What's the main takeaway from all of this? It all boils down to this simple principle. Even with all those scary symptoms, the racing heart, the dizziness, you can't let yourself overcomplicate it. At its heart, this is a straightforward case of dehydration caused by gastroenteritis. So the solution is just as straightforward. Rehydrate the patient and get the nausea under control. That's it. That's the whole ballgame. You know, understanding the logic, the why behind a treatment is so much more powerful than just memorizing steps. It turns a checklist into a strategy. So now that you see how this was all broken down, it kind of makes you think, doesn't it? What other common medical advice out there has a simple core principle that maybe we've been overlooking? Something to chew on. Thanks for tuning in.